Hello, guys. Good day. This is Anna of Reinforcement Club. Today, we're going to talk about why nurses are leaving Philippines.
In this private hospital south of Manila, nurses are young. Most of those staffing this desk had only recently graduated, and chances are they are not going to spend the rest of their careers here. I asked if they plan to work abroad. The answer is a resounding yes. The main reason, the relatively dismal pay, as low as $200 a month in some small private hospitals, a third of what the government pays nurses in public hospitals. Action worsened during the pandemic, when nurses and other healthcare workers didn't receive their special risk allowances from the government on time. Filipino nurses have been leaving to work overseas for years, but the number increased dramatically during the pandemic. A recent study in the Journal of Global Health estimates private hospitals like this have lost the most, with about 40% of their nursing workforce quitting since 2020.
Look, it's more fun to be a nurse in the Philippines if we only get the things that we have in abroad in the Philippines. Philippines is one of the largest supplier of nurses around the world up to this point, 2024. Now, again, why are nurses leaving? Why are we here? Why am I here? Look, it's hard to be in a situation when you get to choose between your family or your country. Well, of course, you have to pick your family. Come on. And it's already been a global crisis ever since, and it's hard to survive in the Philippines if you don't have enough. Now, I got three reasons why nurses are leaving the Philippines. And this is also based on experience, personal experience. We're getting personal here. Now, the first reason why nurses are leaving is that because of high nurse to patient ratio. So what happens is from the time you graduate nursing, and this is for student nurses too, you will get involved into a hospital institution which is already understaffed. It's overwhelming. It's overwhelming, yeah. That's true. Stressful, yeah. And you're going to be overworked from the time you were hired. That's a guarantee. You know, tell me that I lied. If you work in the Philippines, you know what I'm talking about. And it's difficult to provide a standardized level of care that the patients are expecting because of the situation. Think about it. My first hospital, the institution that I work for and I work with, the maximum bed capacity that we have was 30 in that ward. And we are three nurses. We were three nurses doing the job. One is the desk, the charge nurse, and two medication nurses, plus one healthcare assistant. No, is three nurses is to 30 patients. Okay, 30 patients. All right, 30 patients. But we have different cases. It's a general ward. So when I say general ward, it's mixed of cases. Like we have like 6 to 8 beds for pedia. We have a male ward, which should be up to 10 beds, and then female ward, and then private rooms, which will be filled with cases like respiratory problems, patients with cardio problems, gastrointestinal, neuro, infectious or not, we got it. And there's only three of us. Sometimes we get to handle patients after cardiac arrest. They're still in the ward with the ET tube, with the patient hooked to a ventilator in a ward. Sometimes in that 30 bed capacity, sometimes it's two patients hooked to ventilator in a ward because there is no ICU bed available. Even in the near hospitals, the ICU beds are full. We're still waiting, we're still in line, so that's why the patient has to stay. In the public hospital, yes, they have good pay, but there is what they call a shall I say what we call uh it's OB-GYN ward. It's a mixed ward. So we have 3 to 6 nurses with a minimum of 50 patients. 50 patients, let me explain. Because that ward will be mixed with postpartum patients, OB-GYN cases. And most of the time, that ward, OB-GYN cases, will be filled with postpartum patients. And in one bed, sometimes one bed is used by 2 patients. In the pre-labor, one bed is used by 2 to 3 patients. That's in the public hospital. So let's say 5 nurses, 5:50 patients. What if one is sick? That's the start of the war. Now, that is actually frustrating and will lead you to helplessness. But when you get to expose yourself in those areas, you don't think about frustration or helplessness anymore. It's a war against yourself. Yes, it is expected that it's going to be stressful, but in the longest time that you expose yourself in the area, you forget about the hassles. You get used to it. You can make your own routine. You get over all the problems. It's just that it is stressful. And given this high nurse to patient ratio in the Philippines, the government has a lack of support. So yes, they encourage people to take up nursing, but they don't really uh, back up with financial sustenance in order for a couple of portion in the population will take up nursing. They just promote and okay, you got it. That's out of my responsibility. We're just promoting it so that you can go abroad, you can earn dollars. That's that's the promotion is about. That's the bandwagon. Everything you can see it. You can see those advertisements in the schools. They don't promote. Yeah, no, they don't promote nursing, bachelor of science in nursing, in order to serve the country. I'm not against it. As long as people have choice whether to stay or go, then that's be fine. I'll be fine. That'll be fine for me. Another thing is that in spite of this high nurse to patient ratio, we don't have much training. And besides, if the hospital will give us training, let's just say in a year, okay, one training, we've no room to spare time in order to attend to that training because we are overworked. So what usually happens then if you try to observe a newly graduate who's been hired in a particular institution? Okay, that newly graduate will stay, okay, to gain experience. Let's just say a minimum of 2 years. But 1 year, yeah, Middle East hospitals, good hospital, high standardized hospital. Some nurses can go there with 1 year experience. They can get hired. But let's just say 2 years. That newbie or beginner nurses going to novice and earning more experience in a particular institution in the Philippines, for sure. Okay, you can see them. You can still see them in 4 to 5 years. But as the economy is getting worse, for sure, that staying in the same institution for that nurse will be, kind of shaky, in a shaky dilemma, because surviving in the Philippines was really extremely hard financially. So going abroad will always be a good choice. That's why nurses are here. That's why we're here. Now, speaking about the mass resignation, it won't happen right away. Let's just say that there's a batch of newbies nurses, like 10. You try to check them out 2 years and beyond. Those 10 nurses won't stick around for sure. They wouldn't stick around. Uh, UK or US or Australia will advertise that they're taking this, they need nurses, and they try to lower their qualifications of nurses that they're accepting. Those 10 nurses will be gone. Like, all right, unless they have good, they were able to marry a man or a woman who is financially stable, they will stick around, but most of the time they'll all be gone. The second reason why nurses leave Philippines is that because of the low salary. So the beginner, let's just say the newly graduates, the starting is around 22,000 and above. This time, this 2024, that is 400 or 350 to $500 per month. And for public hospitals, for public hospitals, it depends on your rank. But the starting is 50,000 pesos, which is $800 and beyond per month, depending on your rank. And that promotion is rare. And the talking about the working hours, it's 45 hours per week in an 8 hours shift, or 48 hours per week in a 12-hour shift. That is 4 times a week with that salary. Other than that, given our standardized minimum wage, the inflation rate, the average inflation rate in the Philippines this 2023 is 5.84%, and to other resources it's 6%. So it's still expensive. Inflation rate is the rate at which the prices increase over time, resulting to fall in purchasing value of the money that we have. Plus, with that amount of salary, we have less or no benefits. We only have PhilHealth and pag-ibig savings, voluntary savings, and then SSS or GSIS. That's also voluntary for pension. And if everything goes wrong, these benefits wouldn't be enough to sustain the damage. Lastly, the third reason why nurses left Philippines is that it's because of the insufficient career advancement opportunities. With all those long working hours, yes, plus stress, nurses have no room for extra class anymore. We prefer to have time with family and friends rather than going to the class and still the same, working on the same workplace with those workload and nothing is ever changing. So we prefer to have fun. The healthcare facilities in the Philippines are underfunded and there's a shortage of necessary equipment. But the good thing about it is that the doctors and nurses became innovative, resourceful. We can do a lot with the supplies that we have. We can still manage to save patients with what we have, regardless of the things that's missing in our life. And we almost have no training. The only training, which is the best training in the world that we have, is it's the situation. It's the cardiac arrest, the cold blue, different types of emergencies. Those are the only gold mine training that we have, and we cherish it so much. All in all, The reasons why nurses leave Philippines is because of the high nurse to patient ratio, low salary, and insufficient career advancement opportunities. It has to be solved by with the cooperation of the government and private sectors if they care enough to solve this problem in the country, which is part of healthcare, thing. However, although Philippines is kind of crucial in a critical condition in terms of healthcare sector and in the making of workforce manpower, Filipino nurses are also known around the world to have the ability to establish a strong connections to patients, giving them comfort and support during their vulnerable moments. Filipino nurses also still has and always have exceptional clinical skills and of course hardworking, great work ethic, and is willing to work overtime. Anyway, that's it for today. This is Anne of Reinforcement Club. Thank you very much for your time and have a lovely day ahead.